Namaskar, sir.
Namaste Shivani ji. How are you?
I'm good, sir. Always good to see you and ask different questions, having insightful conversation with you. So it's always a pleasure to have you, host you for different programs, for different conversations.
Thank you so much. It is likewise because you are doing a lot of good work, spreading the knowledge to a lot of people together and to the right kind of audience actually, who can actually help and support the society and people who are suffering from different kind of chronic disorders. So it's a good effort, and I appreciate your hard work in this actually.
Thank you so much, sir. So the ultimate intention is we very well know that human civilization never had these issues. It is the life. We let us put it this way that it is lifestyle issue. But if it is lifestyle issue, we need to correct it. There is a precautionary science. There is a preventive science there, but we should also respect to the treatment science. There is a treatment side. So today we are here to discuss about the supportive, the care, the wellness care which we can offer. So, sir, instead of saying that what Ayurveda can do, let us first say that, or shall I put this way, that let us first discuss about the don'ts, where we have to draw the line. Because currently it is the time of abundance in terms of knowledge or in terms of food or in terms of whatever options we'll say. But and there is as soon as we type on AI or any other platform or we reach out for the content, we get to have this kind of understanding that how Ayurveda can support. But let us first understand this thing, that how when we speak about Ayurveda in cancer care, where should we draw a line when it comes medical treatment and supportive wellness care?
Yeah. So definitely, to nowadays, a lot of knowledge is also there online. A lot of information is also available, and through AI and all these like search engines and all, we can collect a lot of information. But one thing we should understand that that is a collective information. Whatever someone has feed on in the data, it is just collecting it and feeding it to you. So, and it is not evaluating anything, it is just providing the information. So, evaluation is very, very important. What stage of cancer is it? Whether it is acute stage, chronic state, whether it is malignant or it is just in a tumor form. So, in different scenarios, because cancer is a disease which affects mind, body, and even the soul of of the person who is suffering from it. Not just the person, but the family who is attending to it and who is taking care of the person. So it is a phobia kind of feel that comes and grabs the entire family. So you just say the word cancer and everybody goes into the panic actually.
Life comes to
So
freeze.
yeah, so because people start thinking about the worst that can happen, so they don't kind of go to that extreme end that everything is finished now. It is not like that. Cancer can be curable if tapped in right stage and right proper treatment actually, with all kind of support that the person can get, can recover, and people have recovered well and easily actually. So first and foremost, it should not be handled apart from any other oncologist. So only oncologists should handle any cancer-related disorder if it is diagnosed in that way. Ayurveda can be there as a supportive treatment
Mhm.
if it is a very preliminary and very initial stage of some module development and all. So then some herbs and all can be used. But once it is spreading and multiplying, it is growing, then we need to do radiotherapy, chemotherapy, or any kind of modern sciences that things to. So basically, needs is to life saving. It is not like any that okay, no, only Ayurveda can treat it or only medical. So it is not a fight between pathies actually. They can come together, and even oncologists are also suggesting different kind of foods to eat and diet to and lifestyle to follow actually. So that helps. So we cannot say no to oncology, but we need to incorporate Ayurveda also as a supportive care and to improve the quality of life, basically.
So, sir, here, since you have mentioned about diet and food, I want to know a yoga teacher or a wellness therapist is not an oncologist or is not a certified dietitian. How, what should they understand about Ayurveda so that they can apply those things responsibly?
The major concept in cancer care is Agni, actually, the digestive fire, which becomes highly compromised because of the medicines that have been prescribed or any therapy which is going on, basically. So, digestive fire gets really compromised, your liver get really compromised. So, diet and lifestyle should be focused more on how the person is able to digest. It is not about nutrition, it is not about deficiencies, it's not about what all we can provide to the person nutrition wise, because every food is a good food only, and unless you are unable to digest it actually. So that becomes toxin for you. So your body is already dealing with a lot of toxins through the chemicals, through the medicines, through the radiation and all. It is fighting with your own immunity actually. So we should not overburden the person's digestive fire with loads of nutrition, loads of calories or something like that. So digestive fire is very, very important in such case. So understand the Agni concept in Ayurveda and the doshas, Vata, Pitta and Kapha, how Agni behaves with Vata, how Agni behaves with Pitta and how Agni behaves in Kapha. So if accordingly a yoga practitioner or a cancer care therapist or any person who is taking care of the patient understands the person's digestibility, whether after the food the person is feeling sleepy, sluggish, giving all the nutrition, still the person is not feeling energetic and kind of feeling lethargic and heavy, bloated, constipated kind of thing. So then that indicates that the Agni is not strong enough to digest the wholesome, nutritious food. So small divided meals or choice of foods which is easy to digest is recommended accordingly, and some home kitchen spices can be used for improving appetite, improving liver function, improving the detoxification as well.
So, sir, here, since you're talking about food and diet, let us start with one of the terminologies that is trending online: miracle diet for cancer, detox
Mhm.
diet for cancer, immunity boosting diet for cancer. How incorrect or I'd say misleading or unsafe these diets can.
See, these all fancy words and taglines for different kind of diet plans that people are selling online is just to sell something to you. Basically, it is not nothing. No miracle diet is there which can cure cancer. Is a very bigger thing. Not even a cough and cold cannot be cured by a single miraculous diet and generalized for everyone. Actually, it should be specific to the person according to the constitution, according to the digestive fire. What the one person can feel happy and healthy with a heavy meal. Another person, for him, it is a toxin because he is not able to digest it. So there is no generalized or standardized meal or miracle meal for everyone basically. It should be individualized. Understand the symptoms, what the body is indicating, because body is going through a lot of chemical changes and pharmacokinetics with the medicines, with the therapy and radiations and all. So it behaves differently than a normal person before that, basically. So we need to understand and accordingly plan the diet for the person.
So, sir, I totally understand from where this is coming that okay, yes, one diet does not fits for all. I absolutely understand. But sir, there are so many. I'll say as soon a person is affected by cancer, yes, there is a complete focus on medical treatment, medicines, but there's also something that person seeks alternative medicine. And there in the alternative medicine, there are a lot of different kinds of overwhelming and conflicting diet. But if you have to give an advice to that person where they should begin with, what it will be, sir?
To start with is to build up more confidence in the person that okay, you are not like on a deathbed immediately. You can have a good life and can live with the disease, go through the treatment process. So mind healing is primarily more important than actual physical symptomatic healing, because most of the symptoms can be psychosomatic also. Now the
Yes.
person is in trauma, and then his body is responding to that trauma and that hormones basically. So to start with is to ground, understand, accept the problem that you are into. It is a fight basically. It is a fight against cancer. So you are not just fighting with yourself, you are fighting with the lot of emotions, lot of stress and trauma as well. So for that, acceptance is important. The person should understand, okay, fine, this is the thing that has happened, and now I have to change a lot of things in my diet, lifestyle, food eating patterns, my likings, my dislikings. Mentally, a person who is stronger and alive is more chances to recover faster. Actually, you can face the music actually. So because it is treatable nowadays with a lot of research and a lot of medications that has been developed, it is 100% treatable. Doesn't matter at what stage you are. But mind plays a lot of major role in such cases. Actually. So
I
to start
absolutely
with is
agree.
to improve on motivation levels and understand self-understanding also, and the people who are treating them should also console and bring in that confidence that okay, nothing, you are not something wrong with you. It is a phase and we have to go through this basically, so that is more important. And then gradually, as per the symptoms that body will indicate, we understand the constitution, the digestibilities, the choice of the foods can be planned accordingly. So to start with is to first like simple cooked food will be better rather than having a lot of raw things and cold things. So basic like do's and don'ts needs to be incorporated at the onset, and then gradually as the person responds to the treatment, we can manipulate or modulate the diet and eating patterns as such.
So, sir, since well, let me put this way that you always say that kitchen is a first pharmacy, and a lot of cancer patients suffers from nausea, low appetite, bloating, constipation, and I'm talking about cancer patients, not the
Yeah.
general people. Um, what will be your suggestion? What will be those things which they can easily pick from their kitchen and irrespective of what kind of cancer they are suffering from, they can still use it.
A lot of kitchen spices are there for, especially in when a person is going through chemotherapy and all, the digestion gets compromised, as I said before. So to improve the secretion of digestive juices, to improve the liver function, to improve the absorption of the food and nutrition. So common spices like ginger is okay, fennel seed tea can be taken. Cumin is very good and effective in reducing the bloating, gas, and acidity kind of thing. Cinnamon is also fine. So there is no contraindication to chemotherapy with these spices that we use in kitchen. The mixture of the combination like garam masalas and all the black red chilies and all that needs to be avoided as much as possible, because anything which is inflammatory can improve or enhance the inflammation which is already there in the system. So common spices like for stomach ache or nausea kind of feeling, ginger can be taken with warm water. If a lot of bloating gas is there, cumin, fennel can be taken. If constipation is there, then you can also add some hard, which is mild laxative, or trifla can be taken, so which is very safe to take, and there is no contraindication to chemicals as such. Even consumption of like a good quality cow's ghee is also recommended. So it depends on person to person and what part of the body is suffering from the cancer. So the home remedies can change accordingly. So, as I said before, there is no universal guidelines, as we say, for like vata diet, pitta diet, and kapha diet kind of thing. So in cancer, fluctuations can be remarkable. Sometimes, some part of the day, vata might be extremely active. Sometimes of the day, pitta might be extremely active. So you need to change accordingly, and that is the understanding that we need to develop. Through this course, also we are going to plan in such a manner that the person who is taking care of the or guiding the cancer patient should understand these fluctuations. So your constitution also will behave quite differently. So there will be a lot of fluctuations of doshas also. So accordingly, we need to. So there is no ground rule or a sticky pattern that we follow all through. Depending upon what is the condition, which what is the dominance of the dosha, the remedies and the recommendations can change.
Absolutely, sir. And we are so grateful that with your module, you have elaboratively created the concepts for the yoga therapist to understand that how what kind of key role they can play in supportive care, supportive wellness for these cancer patients. So we are really grateful to you for those reasons. Um, sir, but now going back to my the same question, you also say that you are what you digest. And at this point of time, there are so many healthy labeled, organic, healthy labeled food available out there. So, and I'm talking about not with the cancer patient, but I'm talking about irrespective in general. So, people get attracted to that terminology of healthy labeling rather than thinking about can they digest it or not.
Yeah.
And as you always say in your different programs, interviews, that the ama that leads to the toxins in the body that leads to inflammation. So I wanted to understand how selective and how much important it is while selecting what we are eating.
That is the most important part actually. So the food is consumed for energy. So if some food is making you lethargic, heavy, bloated, constipated kind of thing, and your not body is not enjoying that food, even if it is organic, even if it is highly healthy and labeled, even we have seen in many cases that a lot of people feel quite acidic and bloated after taking protein powders and all. So, although the protein powder is a very healthy labeled and well marketed product as such, but it is the Agni that is not able to digest it, absorb it, it is not ready for such overload of nutrition at once. So, if such is the case, then we need to divide it into multiple smaller doses than consuming it at once. So, that kind of mindful awareness needs to be there. So, as I said in my lectures also, no food is a bad food. Some food is good for someone, some food is good for another one, basically. The same food can be a bad for many people as such. So, there is no concept of good or bad in Ayurveda. It is as per your digestibility. Like in few diseases, we suggest a lot of heavy eating meals also, where there is a vyadi called Kshay Rog. Kshay Rog is where your body is depreciating very fast. So in such cases, we need to provide a lot of nutrition, heavy nutrition, for the body to slow down the depreciation basically. So in such cases, we recommend a lot of heavy eating patterns, a lot of like cheese, butter, paneer kind of to slow down that aggressively active digestive fire and keep it busy, not going into autophagy basically. So, as I said, no food is a bad food for it. Is your body needs to understand, like feel better how
Absolutely.
after consuming the food, basically.
Yes.
So, if
So
some meal is extremely healthy, you read about it, you make it for yourself, and you eat it, and you feel bloated. So that means your body rejected it upfront. So it doesn't suit your constitution or your digestive file.
okay. So sir, this has something come to me as a new concept where you are mentioning that no food is a bad food. And it you have to understand your body constitution and your lifestyle as well, uh, so that you can digest it, right? Now here, if we are talking about a person who's undergoing cancer treatment, what will be your suggestions to that person while picking the food? What will be as in like because not necessarily this person is located in Asian geography. So this can be demographically and geographically they can be distributed. So if you have to give any tip which can universally be accepted for a cancer patient, and especially talking about the Agni, keeping in mind the Agni, what will be that tip for?
Um, to be on the like, if you ask me for something which needs to be suggested for everyone actually, So the only thing that I would say is warm cooked food, easy to digest meals are recommended actually. Not consuming too heavy, oily, spicy things and all. So homemade meals are always okay. So it doesn't matter in which place you are residing or in which continent you are staying. So, fresh home cooked meals are always recommended, and small divided meals are best to digest faster because your body is already busy in a lot of chemical processes. So, you don't overload with a lot of nutrition or foods basically. So, small divided meals is recommended at regular interval and avoid mixing too many things together. Keep it simple, as simple and sattvic as possible. Don't mix too many fruits together. Don't consume too many kind of vegetables mixed together in a salad form. Don't mix too many grains or two proteins together. So keep it one protein at one time, one fruit at one time, one nut at one time, one seed at one time. So spread it out throughout the day. So whatever comes to your gut recognizes it properly and digests it to the fullest. So that work is done, and your body feels energetic and gets the maximum nutrition out of it. Actually.
Sir, we have got a question. What about dairy in this?
Dairy products, right?
Yes.
Uh, Depends actually. It is, as I said, it is if the person doesn't feel bloated, heavy, constipated after consuming dairy products, doesn't matter. The source of dairy is very, very important, as I told you in my earlier lectures also. A good quality cow's milk is considered as amrit in Ayurveda, actually. But we don't get that quality. It is
Mhm.
processed, it is kind of go through a lot of processes and then reaches you. So the concept of sattva is already diluted from that milk. So it is just a source of nutrition for you. So then it becomes another food only. If you are able to digest it, you're feeling okay, then it's fine. But if you can get a real quality, good, purest form of cow's milk, nothing better than that. It should be a single cow's milk. Once it should be naturally, not through the hormones or the natural pregnancy of the cow when she gives birth to the calf. Once the milk is consumed by the calf and the remaining milk is you are receiving, so nothing better than that. So that's the dairy concept in Ayurveda. But in now modern world, we don't get that. If we are staying in like big cities and all. So that's why in Ayurveda nowadays we are like refraining from suggesting a lot of dairy products as such.
So, I have a question here. There are a lot of misconceptions. Now, for an example, you have mentioned that what are the reasons that dairy is avoided. However, so far what I remember is that all the medications, most of the medications in Ayurveda is given as a base with ghee. So, if Ayurveda is stepping out and saying that because of these reasons we are parting away from dairy, which really makes sense, I'm sure there are other misconceptions also or myths. So, let us talk about any misconception which you would like to address through this conversation, which people or yoga therapists or any wellness practitioner thinks about it, about Ayurveda lifestyle, Ayurveda treatment, especially given during the cancer treatment to the patient.
The biggest misconception is these miracle and magic words and magic herbs or magic products basically. So that is the biggest misconception, and it is the internet is loaded with such kind of things which gives a false hope actually, and they are very expensive also. So it is just mincing money through your false hopes. So that is the biggest thing that people should not fall in trap to actually understand the disease, understand your body, and accordingly select what. Because as I said before, that your body will start reacting differently, behaving differently. What you are able to do before starting your chemo and radiotherapy will be difficult for you to follow in the post therapy concept as well. So, misconception wise or unwanted false hopes is not recommended. Better to have a calculative and understanding perspective towards the disease and toward your own self. So don't fall for a universal diet, don't fall for a universal herb that can cure everything. Nothing like that in Ayurveda. Even for a normal disease, there is no universal herb or drug or spice basically which can treat everyone in a single go. It is person wise, individualized, and depending upon your constitution, your agni, your digestibility, what is your strength and stamina of your overall well-being as such. So that is the biggest thing, because a lot of Ayurvedic they use the word Ayurveda and promote a lot of misguiding information online. So Ayurveda is a lifestyle and it has nothing to do with herbs, diseases, diet plans, or anything like that. Eat with your biological clock, eat as per your digestibility and anatomy, and try to stay as like organic and natural as possible according to your available sources of food in your area. So that is the concept of it. Is Ayurveda is actually very simple. People have made it complicated and what we say marketed it in such a way that it can do a lot of many things actually.
It is, sir, something which is complex always seeks people's attention. So that's why it has been presented this way, I'll say. But yes, the people who practices Ayurveda in their daily life, the people who follow Ayurveda as their primarily treatment or precautionary way of living life, I'm sure they find Ayurveda as simple practices.
Yeah.
Uh, moving ahead, sir, how important it is for a yoga therapist to understand medicine, to understand medical treatment before being there as a supportive care for any cancer patient.
See, very very important for anyone who is taking care of a cancer patient. You should first of all understand the effects and side effects of the medicine that is prescribed by the oncologist or the radiotherapy or any other therapy that is going on uh, as a modern perspective basically. And accordingly, a yoga therapist or a person who is taking care of the individual should understand the interaction also. So which herbs are not to be prescribed,
Right.
which spices not to be consumed with these chemical medicines as such. What is the contraindication? What is the interaction? What will happen if one side you are giving immunosuppressant and another side you are giving immunity building medicines or herbs? So both are contraindicated to each other. So that is a kind of complete no-no. So never push anything which build up on your immunity as such. Because chemotherapy medicines usually are working as an anti-immune medicine. So they are compromising on your immunity so that your body's cells are not multiplying in such manner. So different kind of chemotherapy medicines are there. So you should understand the modern medicine first. If it is a immunosuppressant or anything in such manner, so don't push for immunity build-up medicines or diet plans or lifestyle accordingly. So you should maintain it, but you should not enhance it actually.
So, sir, you have like this is a very beautiful concept and a very basic concept what a person should take care of it. How a kind of practice which you are following can be contraindication for the medical treatment what is happening. So sir, can you help us in understanding that with this upcoming teacher training course, with your module specifically, what students can take away?
Yeah. So we will first of all understand the concept of cancer in Ayurveda, how it is portrayed in Ayurveda so many years ago. So it is not like something has come up in nowadays, or it is not a modern day disease actually. It was there in Ayurveda time also. Like our Ayurveda is almost 5,000 years old, so it is written in that time. So first we will understand the concepts of cancer in Ayurveda, how it is interacted with the doshas, vata, pitta, kapha, and individual personalized thing. What are the primary symptoms or the processes that the body goes through? And accordingly, we understand the concepts of digestibility, agni, what foods are um, good for such kind of conditions, what are good diet plans or easy to digest food for vata, pitta, and kapha constitution people and all. What symptoms the one should expect and what treatments that we can recommend very safely without causing any interaction with chemical medications around. So all those concepts will be clubbed in together and given as a knowledge to whoever is joining the course basically. So after the course, the person will be understanding the nature of the disease, the nature of the person, individualized, what symptoms the person is indicating, and what dosha is related to that. And accordingly, we can choose from home spices, the food pattern, the choice of vegetables, fruits, all kind of nutrition really, so that the person should not become nutrition deficient and he is digesting well also. So all that thing is being clubbed together to give us as a knowledge.
Makes sense, sir. And I'm sure that with this program, the graduates feel more confident while working closely with the cancer patients. Sir, before I move ahead to my next question, I think our audience is quite inquisitive and they have dropped a question. What happens in a well oxygenated body? Because we are asked to take antioxidants. And what about pH level of the blood?
Yeah. So as I said before, like every body is a different body. So there is no kind of universal thing for everyone. If a body is well oxygenated and we are taking antioxidants and because antioxidants are reducing your kind of cleansing your system. A body is clean. It doesn't need antioxidants actually. So, and you are unnecessarily forcing your system with a lot of antioxidant medicines and all. So, it is a kind of toxin. So, whatever is not needed in your body is causing as a toxin in your system. So, understanding the body's symptoms, whether it is not giving any kind of symptoms, whether it is healthy even after chemotherapy and radiotherapy and all kind of therapies. So then unnecessary supplementation is also not required as such. And maintaining pH is very, very important because the acid or acidic pH is only in our stomach to break down the food. Rest of our body is alkaline nature.
Right.
So maintaining an alkaline pH all through the body, whenever there is a drop in pH, inflammation increases. So maintaining an alkaline body, having alkaline like detox waters and all is very healthy hydrating for the system and goes well with the stomach acid also. It doesn't neutralize. So that is how it should be. So unnecessary medication, antioxidant supplementation is not required until unless the report is indicating towards deficiency. And that also, if it is going well with the medicine that the oncologist has prescribed. So there should be no interaction or no interaction between these medications as such.
So, sir, okay, we spoke about the alkaline thing, but going back to my question, I hope, yes, I'm so glad that the audience is very well satisfied with your answer. So, sir, going back to my question, we were discussing about the food diet, but there are situations, especially in the advanced stage of cancer, when a person goes through different kind of complex surgeries, different kind of treatments, they find their body unfamiliar. How Ayurveda plays a role in reconnecting with their body, in rebuilding that faith in the body.
So Ayurveda definitely will help with better nutrition guidance and all lifestyle and all. It is the most important part that is the people who are taking care of the person or the doctors and therapists who are attending to it. So build in the confidence that mind should always remain strong and ready to fight to face the challenge actually. So body will respond accordingly. If you are into trauma and you go into depression and all, then the healthy body also can become traumatic and depressed actually. So the fear and phobia should be treated first at the onset, because if it makes its roots in your subconscious, then whatever you do it with fear only. So that fear should be removed at the initial stages. So yoga therapist, Ayurveda practitioner, or a doctor who is attending to them, because oncologist will not definitely do a lot of counseling part. So he will only understand the disease, he will prescribe the medication, whatever therapy is recommended. Then the role comes to the dietitians, yoga therapists, nutritionists, Ayurveda doctors, and all to guide him properly and improve the mental and state of the overall well-being, and make his life easier, not complicated with different kind of decoctions, medicines, and crash diets and everything. Don't make it complicated. Make it easier for him so that he doesn't feel some alien in between normal people.
Right.
Keep the home atmosphere lighter, so that is more important. More happy hormones in your body, more faster you heal. That is core to it actually.
Yes, sir. Absolutely agree with it. And sir, since you are working so closely with so many cancer patients, now I have two questions before I close this conversation. It's purely from your clinical practice. Have you ever come across a patient where your understanding with nourishment, healing, compassion care has completely changed?
Yeah, definitely. There was in my initial stages, like maybe around 5 7 years ago, there was a patient. Uh, I was treating taking care of the diet, lifestyle, nutrition pattern, counseling, a lot of like emotional balances and motivations and all. So I was doing that. But after a few months, the person start giving back the motivation actually. So the person became so intensely, although there was a lot of symptoms, lot of discomfort and everything, but the person became mentally so strong that accepted the problem, understood the disease. Uh, he knows that this is the pattern that I have to go through. So he started giving back a lot of wisdom and motivation. So he feels stronger. And that person recovered fully, completely in around 18 months. He recovered actually. But he had a hell of a life. He traveled a lot with his disease. He doesn't have that depressive phases, and also that 3 4 months of Ayurveda guidance, counseling, and everything has changed a lot. In something changed inside him, and he has become so alive actually. So that motive. That's why I'm saying again and again that mind is important, plays an important factor, and we all as a therapist and people who are attending to the person always focus and counsel the mind. Body can be treated, body can be taken care of, these symptoms can vanish. Even if your leg is broken and a lion runs behind you, you will start running only. So mind will play a different role in that scenario. So body responds. So counsel properly, guide properly, don't make his life complex, keep it as simple as possible, and you will see that the person himself, gains the confidence and gives it back to you actually.
I absolutely agree with you, sir. And in fact, my next question was that have you seen any case where the Ayurvedic treatment has helped person to heal themselves completely? But you have answered it in the same question. And I absolutely agree with you, sir, that psychologically a big role comes for a yoga therapist to work on the counseling, and that's why the backbone of this program, the 55 hours of teacher training course, which we have built together with you and the Yoga Chikitsa Acharya Saraswati ji, with Dr. Balaji and with Rita Date, the intention is the mental health. Uh, that's why we have the longest hour of module is module 3, where we are taking care of emotional and psychology through Yoga Chikitsa. Uh, but sir,
Actually, if you could
uh,
have kept it only Ayurveda, I should have said, okay, no, don't keep it as a pure Ayurveda. Since I see the modules and the teachers who are going to attend it, that's why I said, okay, now it is a well balanced module actually with yoga and psychology and all kind of like pathies coming together in right combination. So
right.
it is not just Ayurveda focused. So as I said in before, Ayurveda can treat it, but we should not rely 100%. A lot of research is going on in Ayurveda herbs and everything. So we cannot 100% keep it as a pure Ayurveda thing actually. So the psychology plays a lot of role, yoga plays a lot of role in this to uplift the person's life and emotions actually.
I absolutely agree with this thing. And also, sir, uh, do you think that uh, yes, cancer is a very big issue, very, very big issue, but have we made it big in such a way that as soon as someone is affected with it, that person becomes discouraged with the life? The first is setback and then discouraged with life, and then bringing that person out of that black hole requires a lot of efforts.
Yeah.
So, so do you think that we have actually made cancer that big in our head?
Actually, a decade back, it was big because that time not much of medications and modern facilities or combinations were available. So either it was surgery, radiotherapy, or some very harsh chemotherapy with steroids and everything. So it kind of crashed. So there was very less chance of coming back from what these chemicals were doing to your system. So that fear has affected an entire generation. So that is still ongoing in like the next generation basically. But nowadays we see a lot of recovery, a lot of faster treatment plans and all. So and safe medications as well. So that it will wean off gradually because the past is not that happy and healthy with cancer care actually. That's why that emotion is still dragging in. And that fear kind of comes in immediately you hear the name of that actually.
Yes, as soon as we hear the name, the fear starts lingering. Uh, but I think that we need a lot of positive stories to step out and
Yeah,
say that how still they can enjoy their life being
that's
cancer affected, but still they have a life. That's one thing. So, and
so,
that's
there
finally
are a
the
lot
most
of
important.
channels on social media also which tell these stories of the fight against cancer or the journey with the cancer and also. So instead of watching unmeaningful reels and stories and everything, people should watch these motivational things that gives in more positivity and strength for the person to come back and gain the confidence actually.
Yes, yes, absolutely, sir. Uh, you have very well given us reasons to follow Instagram. That it can be an inspiring platform for somebody who's looking to live a life. And earlier, there were situations that we were limited because of there was not that kind of connectivity. That's why we were limited to only the kind of people who's living next door. But I think with Instagram, with social media, we are able to reach out and inspire ourselves, especially in
Yeah.
this kind of issues. And yes, so here we come to an end to this beautiful conversation, to this insightful conversation. Thank you so much, sir. And
Thank
thank
you.
you to all the people who have joined us today and will be watching it later. I would like to tell you that this cancer teacher training course, this program, Cancer Rehabilitation through Yoga and Integrative Healing, a 55 hours online yoga teacher training course, start from 23rd of August, where we have mentors like Dr. Balaji, Saraswati Vasudevan, Dr. Pankaj Chansarkar, and Rita Date, who have come together to build this beautiful program where we are trying to upskill wellness professionals, therapists to be there standing as a supportive, strengthening unit for any cancer patient. So we'll be more than happy to address your inquiries. We have free session on 9th of August, which is day after tomorrow on Sunday, 8 a.m. in the morning, where we'll be where all our mentors are coming together and sharing the part of their material. We'll be more than happy to have you join us. Thank you so much, sir. And thank you
Thank
everyone
you.
for joining us.
Take care.